Good morning. It is, I'm sorry, I don't have my computer. I have no idea what day it is. 30th, thank you. It's Friday, the 30th, and we are hearing from Ledge Council on H266. Apparently the Senate amended it, so we have to hear the amendment. And go ahead, Jen.
All right. Good morning, Jen Carby from the Office of Legislative Counsel. I will put the amendment up on the screen here, and then I will also remind you of what it refers to. So we are looking at H266. This is the Senate proposal of amendment to the House proposal of amendment to the Senate proposal of amendment. And the Senate concurred in the House in your proposal of amendment on H266, an act relating to the 340B prescription drug pricing program, with further proposal of amendment by striking out section 5, which is the 2025 provisions around limits on the average sales price, percentage of the average sales price that hospitals can charge for outpatient administered drugs. So they struck out section 5, and then in section 6, the effective dates, they would strike out subsection B and renumber subsection C to be subsection B. So now let me put up what you sent them so we can look at what language is struck. This is the House proposal of amendment. This is what you sent over to them. You had concurred with further proposal by striking out sections 4 through 7. That was the white bagging and the effective dates, and putting in new sections 4 through 6. So section 4, they would leave in, this is the limitation on outpatient prescription drugs administered in an outpatient or office setting, limiting that to 120% ASP for any drug that they were charging more than that as of April 1st, and then kind of locking in the percentage of ASP for anything they were not charging that much. This is effective January 1st, 2026. This stays in the bill in their proposal, but they would strike out section 5, which is the limited piece from July 1st, 2025 through December 31st, 2025. That was the 130% ASP limitation for drugs for which they charged more than 120% as of April 1st. So they would take out the July 25 to December 25 piece and not start these limits on the outpatient prescription drugs until January 1st. And then they made a conforming change here just to take section 5 out of the effective date section. So when you hear some people are describing it as they just changed the effective date, that is, that's not mechanically what happened, but in essence, that's what happened, is that they just went with the section 4, January 1st, 2026 effective date on that limitation and struck out the 2025 piece.
So hospitals may continue what they are doing currently until January 1st of 2025. 6th. And then,
Right.
And then they have to go to 120.
Status quo until January 1st, and then this 120% limitation goes into place.
And just because I know that we made several changes, the piece around appealing to the Green Mountain Care Board, because we had originally had it in just one section, was that struck out as well? And do we have that protection in the other section?
I mean, being able to demonstrate that there's a negative impact. So yes, all that was in both sections. And so all of section 5 largely replicated section 4, but with a different ASP for the charges for the higher price drugs for the first 6 months.
All right.
So that whole section is gone, but all of the protections and the carve out for the critical access hospitals, all of that remains.
Okay. Leslie and then Woody.
So just so I understand the timeline, that means the QHPs have to submit their budget requests in July, I believe, and then it gets approved in August, which means that the 23% will stand because we can't, we won't
So
have.
they've already submitted rates, and they've submitted rates for the 2026 plan year. This will affect the 2026 plan year. So whether they need to modify.
So they can do that, then there will be a modification
I expect so, but I defer to.
Yeah, I'm just trying to understand, yeah.
You'll still be able to do the actuarial calculations for the 26 plan year. Okay,
And the board will be looking at that in their rate review analysis.
okay, great. And I don't see Laz in the room, but
Yeah.
will it affect the hospitals in their budget review?
Just said, we don't see that.
Will they be able to make those calculations in what they submit?
So, and we
School year starts in October.
Fiscal year starts in October, so their fiscal year will reflect 3/4 of this provision that takes effect in January of 2026. So I expect that that would be reflected in their budget requests. But they won't have had, they won't already be experiencing those limitations when they submit their budget requests.
Woody,
So why are we doing this? What's the reasoning behind it when Blue Cross Blue Shield is in crisis mode right now and would
I
receive
just
additional
draft what members ask me to draft, so it is not my role to explain the rationale from the other team.
Does anyone know what the rationale is?
You could probably ask the hospitals.
yeah, who was the amendment proposed by?
Senator Williams,
Okay. Terry Williams.
Senator Williams of Rep.
Kevin, do you want
Devin Green from Buzz. The rationale is that the way the Green Mountain Board process is set up, it happened through August and October, and not have the budget orders come out until October 1st. Means that hospitals would have to make changes starting July 1st, operational changes July 1st. And they wouldn't be able to rely on that safety valve that has been set up. And this would give them an opportunity to make their case in front of the Green Mountain Care Board and let them know what the repercussions are. And the Green Mountain Care Board can make adjustments if necessary. The other piece is a lot of the healthcare plans are on a calendar year. And so we thought that the savings would still be happening, the premium savings would still be happening because of that calendar year.
So the hospitals effectively would not be able to absorb July claims because they could put in their appeal on August 1st, in their budget orders on August 1st. So, I mean, basically, we're talking about the month of July.
We're talking about a whole quarter, because the budget order doesn't come out until October 1st.
Lori and then Mari.
So I'm going to go back. I sound like a broken record on this bill and just want to remind people that the underlying bill is to help protect our FQHCs. And if we don't pass this out of here today with this, and not get that bill passed.
Thank you for asking us.
And there are no more amendments permitted
Yes,
at this stage.
more amendments permitted, so no one can
Right.
amend it from the
This is the
floor.
last, right, this is the last stage because it is a Senate proposal to a House proposal to a Senate proposal.
Okay.
Another proposal of amendment would be out of order.
So we either
We either concur
concur or
die.
or it dies.
You could go to conference, but from a timing standpoint, I'm not sure.
No, that's not going to happen.
Yeah.
Nope.
That's not
We
good.
are out of here today.
Promise.
I can't promise that.
Mari,
I will support the amendment, kicking and screaming. I'm really frustrated. Our healthcare system is, and I feel like a broken record as well, is crashing. This is an emergency and you don't run into emergency and say, hey, let's wait a bunch of months. And I believe that the bill that we sent to the Senate had enough protections for hospitals, for critical access hospitals and for other hospitals. And that some of our bigger hospitals had enough cushion, enough reserve to make some changes. So again, I will vote for this, kicking and screaming. And I hope that the hospitals that push for this amendment to slow down the process of trying to save our crashing healthcare system actually do something in the next few months to do the things that this bill around the price caps was asking them to do. And that we actually see some work from them on this.
To think of our system, the whole system. I would encourage anyone, I mean, we're gonna vote on this right now, but I would encourage anyone to go back and watch Senate Health and Welfare yesterday while they were taking testimony on this. I was in the room, there were several of us in the room. And I would encourage people to go back and watch Chair Foster's remarks on this, which were a little bit more, when he was here, we had given him a very short time and he sort of fleshed that out and I'm sorry, it was incredibly powerful. He presented a chart with hospitals and the increase in their revenues. And then he proceeded to put slide after slide of every other piece of our healthcare system and their charts with plummeting everything down. So I share your frustration, Representative Cordes. But this is what we have before us. Any other comments or questions? Hopper?
I'd just like to say, what we're voting on here today is the amendment.
We are voting on whether to concur with the Senate proposal
Right.
of amendment on our proposal of amendment on their proposal. Okay.
And, well, I didn't finish.
Oh, I'm sorry.
And to reiterate what Representative Poet said, we need this bill in order to do the job that we were trying to do to shore up the healthcare system.
All right, well, we'll do a straw poll. All those in favor of concurring with the Senate proposal of amendment? 10-0-1. Thank you, everyone. Thanks, Jen. And we